Stroke, by definition, is a neurological deficit to the brain, which means that there is reduction in the blood supply to the brain. This can occur due to decrease or a deficit in the blood supply to using the posterior channel or the anterior channel. Now, most people develop stroke without undergoing the appropriate physiotherapy management to help them with the recovery. Now, the cardinal signs of stroke are remembered by the acronym FAST. So FAST. So first, this is the face. Face, we look at the drooping of the face. If you have drooping of the eyelids, now that gives us a warning sign that you are likely to develop stroke. A is for arms. If you are unable to lift your arms up, then it tells us that you are likely developing a stroke. Then S is for speech. If you have slurring of speech, then it means you are likely developing stroke. Then T is for time, which means that if you notice any of the three, you should act immediately. F is for the face, A for arm, S for speech. If any of those show any problem, then it means it is time to act immediately. So if you notice these signs within the 4-hour period, that is the window, you need to get proper treatment. That is why it requires emergency. So if you get treatment within the first 4 hours, then it means that you will be able to get adequate recovery. That is, your functionality will be good. Now, that was on the cardinal or the warning signs. So when we come to how stroke presents, stroke will present with weakness on either left or the right side. It can also present as weakness on the upper limb or on the lower limb. So this usually occurs due to frustration. Now, before we get to frustration, what happens is that the left side of the brain controls the right side of the brain, the arms, and the right side of the brain controls the left side of the limbs, which means that if you develop a problem on the right side of the head or the brain, you will have a problem on the left side of the limbs. So what happens is that at this point you will develop what we call the learned non-use. So learned non-use is a concept whereby the hemiparetic, when I talk of hemiparetic, I mean the paretic limb, the paralyzed limb, the hemiparetic limb develops inability to use that side, which means that you no longer use that side. So this learned non-use, it develops, as it develops, it will lead to masking of recovery, and this is how it develops. At first, when you develop stroke, your limbs were properly functioning, but then after stroke, which means that there is paralysis on the left side, so if you try moving the left side, you will have a problem. You will develop that inability to move. Now this, if you do this continuously, it will lead to frustration, and this frustration is what leads you to develop that inability to use this side. You develop that learned non-use, and this leads to the masking of recovery, which means that you do not develop the appropriate recovery that is required. And at this point, what you need is proper physiotherapy. Proper physiotherapy at this point will involve the use of or the training of the paretic side, which means that we put the paretic side into use as we constrain the normal side, which means that if the right is normal, we will use a constraint, which can include a bandage or any load on this side. Then we develop training on the hemiparetic side. So as we do this, we will try to use the brain. We will try to remember the brain that this side should be functioning, which means that we do not train on compensation. We train on recovery of the injured side. For more information, you can book your assessment in the link below, or you can contact us using the email. Thank you.